like to introduce Michelle Buchanan, who is an MSW student here at Wayne State University.
Hi, everybody. So first we're going to go over some quick terminology. Just so everyone knows, the Affordable Care Act and Obamacare are the same thing. And that's just the law that was passed in 2010. And the exchange and the marketplace are also the same thing. And they're both where you go to buy your own health care. And then the 10 essential benefits are just what that health care that you buy for yourself, what has to be included according to the law. And here's a quick video about what's going on.
Well, it's finally happening after years of drama on Capitol Hill. A Supreme Court case, a presidential election, and a Mayan apocalypse that could have stopped it dead in its tracks but didn't. The marquee elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in. And big changes are coming to health insurance in 2014. In the next few minutes, you'll get a pretty good lay of the land by once again watching your fellow Americans, the U-Tunes, find their way through the system. There are 4 main ways nearly all of us will experience health care once the health reform law goes fully into effect. About half of us will get insurance through our jobs, just like today. About a third will get covered by the government through Medicare and Medicaid. About 1 in 10 will buy insurance themselves. And unfortunately, another 30 million of us or so, just under 1 in 10, still may not have coverage at all.
So, like the video said, about half the people in the country will be covered by their employers, and about a third of the people in the country will be covered by the government, either through Medicare, Medicaid, or the VA benefits. About 10% will buy their own insurance, and then about 30 million people will not have health care. Okay, so since the ACA was enacted in 2010, these changes have already been implemented. So the insurers can't use more than 50% of your premiums to pay administrative fees, and everyone gets free preventative services. And children can remain on their parents' plans until age 26, rather than age 18. They could have been kicked off then, so that's good for people like me. And Medicare drug care is better, and each year it'll get better till the donut hole is closed. And then the law gives tax breaks to small employers that do provide health care for their employees. And more good changes, there aren't any more pre-existing condition clauses, so that's great for anyone who has any sort of issues going on. So people will actually get health care when they need it. And you don't have to provide health history to get coverage. There's no lifetime annual limits on your care or your coverage. And men and women will all be at the same rate instead of females paying a higher premium. And then on the marketplace, when you buy your own insurance, you will be guaranteed the 10 essentials, which I'll explain on the next slide. But unfortunately, employers are not required to provide the 10 essentials. Okay, so the 10 essentials are things like outpatient care, so any coverage or any care you would get in a doctor's office or same-day surgery center, going to the emergency room, any care you get during your hospitalization, maternity care, so during your pregnancy and during labor and after labor and delivery, and then your newborn also gets care as well for free. And mental health and substance abuse services are covered. Prescription drugs, and rehabilitative and habilitative services and devices. So if you have any kind of chronic disease and you need help or if you get injured, you won't only be covered for your physical therapy, you'll be covered afterwards with anything that you might need. With laboratory services, so blood testing or routine tests like pap smears and prostate exams, those are all covered. It was kind of unclear if diagnostic tests were covered, so we'll have to look into that more. But also preventative and wellness services, so you get one annual physical a year for free, and also pediatric services, and kids will get dental and vision covered, immunizations, and all the other parts of the 10 essentials also. And just so you know, if your employer already covers you, you will still be covered, and you don't have to pay any penalties. Although some employers are going to change their plans or just so they can cover their costs. So check with them to see if there's any changes in your current plan. It just really depends on the employer. And spouse coverage is not required under the healthcare law. And there's been rumors like some companies such as UPS are dropping spouse coverage, but most employers are not, but they also might be making it, giving you benefits for not covering your spouse. So you might get bonuses or just encourage you to have your spouse look elsewhere for coverage. And there's also no annual or lifetime limits on employee health care. So large employers are required to provide health care for their full-time or full-time equivalent employees, which means people who work 30 or more hours a week. And they have to have 50 or more employees in their company to be considered a large employer. And by the law, they're required to cover the minimum essential coverage, which is different from the 10 essential benefits that you would get when you buy your coverage by yourself on the marketplace. And I'll explain that in the next slide. And it has to be affordable, which means the most you could be charged for your premium is 9.5% of your income. Okay, and so minimum essential coverage, like I said, was different from the 10 essentials covered by buying your own health insurance. There are a lot less restrictions on what employees can need to cover for you, which is kind of unfortunate, but what they do require that employers cover is preventative services and at least 60% of your medical expenses. And by 2015, if a large employer doesn't cover their employees, they'll be fined $2,000 per employee. And then another penalty for employees is if any of their employees enroll on the marketplace, then they'll be charged $3,000 each if someone actually enrolls. But the $2,000 fine is for if they do not enroll. If they don't meet minimum requirements for any of their employees. Doesn't matter if they enroll on the exchange or not. But these are kind of small fines, especially for large companies. So some employers might just pay the fines and not provide very good health coverage for their employees, which is why some employers could be considered to have bare bones coverage because they only cover preventative services and not much else. And so for small employers, that means employers that have less than 50 employees, and they're not required by the law to cover their employees for their health insurance, but they can, and they do get tax breaks if they do. And they would buy coverage on the marketplace, same as you would buy it yourself on the marketplace. And They also include the 10 essential benefits, so all the services I talked about a little earlier. And they're similar to the individual coverage plans. And until 2015, people won't be able to choose much. They'll just kind of have what the employers give them. But after 2015, there'll be more options for the employees. All right, and so the next part is about the government-provided insurance, which is about a third of the country will have. So the different options are Medicare and Veterans Health Benefits and Medicaid. And this is just a slide about where you go to buy it, or so Medicare, you do not go to healthcare.gov, but you go to medicare.gov, I mean, as you can tell. And then veterans do not buy it on the marketplace, but Medicaid, you do buy it on the marketplace. Okay, and so Medicare isn't changing very much. You buy it and receive it the same way as you always have. The changes that are happening are drug costs will go down, and Medicare Advantage quality and access will improve. There are some changes to the drug plans, and there's better ways to access your information. So for the drug costs that will be dropping, that have been approved on Part D, 28% discount on generic drugs and 52.5% discount on brand name drugs. So before, everyone had to pay 100% of both of these types of drugs, but now they'll be discounted. And so the coverage gap, which is the Part D donut hole, will, like I said earlier, will close more and more each year until it will be gone in 2020 completely. And so there's better ways to access your information. You'll get notices on a quarterly basis, and there's an online tool called the Blue Button, and you can download all of your information just by clicking the blue button. And then for the VA, you can receive those benefits at va.gov. If you're already enrolled in VA healthcare, you don't have to do anything. You won't have any penalties or anything. The veterans benefits aren't changing, and you won't have to pay more out-of-pocket costs or anything. And you can enroll if you're not already enrolled at any time.
Good morning, my name is Steve Knox. I'm a second-year law student at Wayne State, and I've been with Kathy in her program since May. And let's talk about the marketplace. So, if you're covered by your employer, you don't go there. If you have Medicare, you don't go there. If you have VA benefits, you don't go there. But if that's not you, that's exactly where you go. So, the marketplace, also known as the exchange, looks like this in Michigan. Okay, so we have a slide out of order. Let's forget everything I just said and go back to talking about Medicare again. You don't need a new card. Nobody from Medicare is going to contact you. There are no limited time offers. Legitimate vendors may be contacting you, but so may scammers. So watch out for that. If you have any questions, don't give out any information, and talk to a trained navigator. So back to, if you have employer coverage, Medicare, VA, you don't go to the marketplace. If you're going to be enrolling in Medicaid or buying your own, you do go to the marketplace. And everything is based on the federal poverty level chart. So everybody should have a copy of this bingo chart. If you are this side, you're going to be purchasing your own. If you are this side, you're going to be qualifying for Medicaid.
And those are income levels?
Yes, those are income levels
Annual.
based on annual, these aren't monthly. Formally, to qualify for Medicaid, you would have to meet income requirements and a disability requirement, and there would be an asset test. If you had too many assets, then even though you met those other qualifications, you would have to spend those assets first or divest yourself of them in order to then qualify. But that's not there anymore.
Right. And then what is the, sorry.
All right. Yep, write it down next to that slide. And we've got, what, at least about a half hour or so for afterward. I'm actually looking more forward to that part than this, so that should be fun. So the Affordable Care Act, the ACA, it expanded Medicaid coverage to everybody in the country whose income is under 138% of the poverty level. 25 states then opted out. So there's about 3 million people in those states who would have been covered except they won't. Michigan did opt in. The legislature passed the bill in September, the governor signed it. So in Michigan, you will qualify. However, there's a little catch. The Michigan legislature did not give this bill immediate effect. So if you qualify based on income for Medicaid, it'll start for you April 1st. Everything else on the Affordable Care Act starts January 1st. And because of this expansion, it's going to cost states more money. The federal government is picking up the whole tab for 3 years, and then after that it tapers down and they'll eventually cover 90%. So all those states that are covering more people now, the federal government picks it up. And you go to healthcare.gov. You'll put in some simple information and then get an immediate answer. Of course, this is all after healthcare.gov works properly. So after you've entered your information and gotten your answer about Medicaid, if you make too much money to qualify, you're already on the marketplace, so you're already shopping for your own. And like we said, there's no more asset test for Medicaid. So in Michigan, who's going to qualify for Medicaid? Well, if you already qualified under the existing program, you still do, such as medically needy, or you're receiving SSI, or pregnant women. The new people who now qualify are those who are 138% of the poverty level or below, and no more asset tests. So Medicaid qualification is based on your household. Who's in your household for purposes of Medicaid is the taxpayer, the spouse, and any tax dependents. And just for Medicaid eligibility determinations, a pregnant woman counts as 2. Or if she's expecting twins, she counts as 3. Everybody who's in the household, their income counts for MAGI. So we have a new term. MAGI, Modified Adjusted Gross Income. The official definition of this is the income that's taxed by the federal government, taking away certain adjustments allowed for tax purposes, and adding in tax-exempt Social Security benefits, interest, and foreign earned income. So what does that actually mean? Here's what counts. What you earn on a job, SSDI, interest, and pension payments. Here's what doesn't count. SSI, TANF benefits, veterans benefits. Child support used to count as child's income. It does not count. And again, this is just for Medicaid eligibility determinations. And also gifts and inheritance don't count. So you've heard me say 138%, you've heard me say 133%. The law is 133%. Plus, you get to take off 5% of what you make first. So in the end, it ends up being 138%. So we've talked about the 50% and the 33%, and now we're down to people who are purchasing their own. Apply on healthcare.gov. There are 4 levels of coverage: platinum, gold, silver, and bronze. The platinum coverage is the best. It covers 90% of your healthcare costs after you've paid your premiums, but it's very rare, and a lot of insurers aren't even going to offer this option. So most people who are purchasing their own are going to end up with gold, silver, or bronze level coverage. That covers 80, 70, and 60% of costs after you paid your premium. There's also a way for individuals under the age of 30 to purchase catastrophic coverage, and we'll get to that. So there are limitations to how much you're going to have to spend. You have to pay your premiums, and then out of pocket for individuals tops out a little over $6,000, and for families $12,700. And again, the monthly premiums don't count toward this cap. So people purchasing their own. What are the there's 4 determinants: your income, how old you are, whether or not you use tobacco, and where you live. There are no more pre-existing conditions, no more surcharges for being female. So the first cost determinant, age. Older people pay more, but there are limits by law. A 64-year-old can be charged 3 times what a 21-year-old can be charged. It used to be an even bigger gap. Tobacco use. Tobacco users can be charged up to 50% more than non-tobacco users. It doesn't mean they will be. That's the maximum that an insurer can charge you. And tobacco use means you've used the product 4 or more times in a week in the last 6 months. And it does include chewing tobacco. So how do they calculate your premium? The premium cost is tied to an average cost for a silver plan in your geographic area. So whatever the average is for the silver plan in Michigan is the starting point for determining your premium. The gold plan will cost you more, the silver will be less. For those who are under the 250% level, which should be on your little bingo sheets, you'll get additional savings on out-of-pocket expenses. These are called cost-sharing reductions. So if you're on the chart, 100% to 400%, if you're on that chart, you'll get a tax credit to help you pay part of the cost of the premium. If you're below 250% of the federal poverty level, you'll get additional savings on the cost-sharing reductions. Those are premiums that you pay, co-pays. But for now, we'll move to catastrophic coverage. This is available for people who are under 30 years old, don't want to buy actual health care. It doesn't have the 10 essentials. It only covers some of the major events, and its main purpose is to avoid the penalty, the individual mandate, for not having coverage. Can you change your insurance plan? Sure. Like a lot of things, there's an enrollment period. Right now, it's begun. And for this first year, it extends all the way through next March to enroll on healthcare.gov. In the future, the enrollment period will be October 15th through December 7th. We think this open enrollment expanded a couple days ago through the middle of April. So stay tuned for more. So back to how will we be covered? We've talked about half of the people will continue to get employer-based coverage. About a third of the people will get government coverage. About 1 in 10 is going to go buy their own. And then that still leaves 30 million people who aren't going to have any insurance. So this is the individual mandate. If you don't have health insurance, you have to pay a fine. You pay it when you file your income tax return. It's based on your income. For 2014, it's 1% of your income with a minimum of $95. And then it goes up in 2015 and 16. There are exceptions for those who don't make enough money to file a tax return. That's where that $95 comes from. If you make under $9,500 a year, you're not federally required to file a tax return. However, someone like that should qualify for Medicaid. So who's not going to be covered? There's 8 million undocumented immigrants who will not have health care coverage. There will be citizens who are not enrolled in Medicaid despite the fact that they could have been. And then there's those citizens we talked about, the 3 million who live in states that did not expand their Medicaid coverage. So they're not going to be eligible for Medicaid, and they won't be eligible for tax credits either. Back on your bingo charts, that 100 to 400% that qualifies you for tax credits. If you're under 100% of poverty level, you don't qualify for a tax credit. So someone who's in a state that didn't expand Medicaid doesn't qualify for Medicaid because that state didn't expand, and they wouldn't be able to get a tax credit. So theoretically, they could go purchase their own on the marketplace, but they'd have to pay full price. So immigrants and the Affordable Care Act. Generally, if you're lawfully present, you're eligible for purchasing health care coverage and the tax credits and the cost sharing reduction. Lawfully present has about 40 different legal definitions. There are mixed status families where some individuals in the family are lawfully present and others are undocumented. The persons in those families who are lawfully present are eligible for the insurance, the tax credits, the cost sharing. And in theory, ICE, Immigration Customs Enforcement, does not use this information to detain people. Again, that's theoretical. When you go on healthcare.gov and you are an immigrant, the USCIS, I don't even know what that stands for, is the one who determines your citizenship. And
Customs and then Immigration Service.
United States Customs and Immigration Service determines your status. And if you have lawfully present status, away you go, you can buy your own health insurance or qualify for Medicaid. If you are not, then what we have heard is that USCIS will not be talking to ICE, but we don't know for sure. So generally, lawfully present means people who hold green cards or have applied for green cards, refugees, asylees. There are special categories for Cuban and Haitian people who have immigrated. It's a temporary protected status, non-immigrant visas such as students and tourists, domestic violence survivors, but under the Violence Against Women Act. It's again, these are special legal official definitions. Make sure you check. And human trafficking victims. LGBT population in the Affordable Care Act. 41% of LGBT individuals and families are under that 138% mark. That's more than 1.5 times the national rate. And 1/3 of LGBT people are uninsured. The marketplace cannot discriminate against LGBT in benefits or in costs. And something that's new, LGBT couples who are able to jointly file a federal tax return and do actually file a joint tax return are eligible for family coverage, tax credits, and the cost sharing reductions. In the future, will there be no more employer-based health coverage? While that's a possibility, at this time it isn't likely. Right now there's 150 million Americans who get their health insurance from their employer, and there's an estimate of about 25 million over the next 5 years moving into the buy your own, still leaving 125 million on employer-based care, employer-based coverage. These estimates come from the Congressional Budget Office, which despite having the word Congress in it, is actually nonpartisan. And their 10-year estimate is that the Affordable Care Act will actually reduce the federal deficit. And we are ready for questions. So